So Cellulite, you say you finally have a system that works.
Yes, there's a new technology that came out, FDA approved. So this one, you can actually treat what's causing the cellulite. So
Really?
cellulite problem is that those connective tissue that's tethering the skin contracts over time. That's what's making the dimple outside. And then the fat cells in between kind of herniate. That's the bulge you see. So if you can target those connective tissues and break it up.
By the way? What is it? A laser? Is it
so it's a laser
frequency?
treatment. So you do make a tiny incision, and then you can numb up the area with a local solution. And once it's numbed up, you can introduce.
What do you do? What do you do?
In terms of the numbing
procedure itself.
Yeah.
I mean,
so basically, you, like I said, you can numb up the area.
So
with
women's
the
thighs, okay.
Yes. Usually the most common area is the posterior thigh and then the lower buttocks.
Okay.
So that's the most common area for cellulite. So those areas, so you can numb up the area with a local solution. And once that's numbed up, you can introduce the laser that's especially designed to kind of split so that special fiber delivers the laser, and then that's able to destroy those connective tissues, which are the vertical connective tissues. So
so you make a small incision.
Correct.
The laser goes inside. Mm-hmm. It breaks up what, the fat?
The connective tissues that's holding the fat cells.
That are making the dimpling.
Yes. So those connective tissues, it's like a beehive, those connective kind of hives, and then the little things are kind of fat cells in between. So over time, that the framework is contracting. So that's what's tethering the skin. So that's the dimpling you see.
Do you see the dimpling, like, you know, with facial fillers, it goes away right there.
Correct.
Do you see it happening right there in front of your eyes?
Yes.
Or is this something
so if you
over time?
break up the what's causing the dimplings by destroying those connective tissue, you can see those skins are released. So it's not as pulling down by those connective tissues. So that's why you kind of see it happening while you're doing the treatment. So
are the patients happy so far with the results they're getting?
Yes, and it's been in track record in Canada, you know, before it came over about 1.5 years ago. So I think we have a good result from that, and then I'm beginning to see good results.
Because there are cellulite technology machines that just kind of create an inflammation.
Correct.
Temporary. Is that true?
Yes.
So this is different. This is different.
Because up till now, you're trying to improve it from outside, but you're not treating what's causing it. So unless you break up that connective tissue, the framework that's tethering, the guys don't have the cellulite. It's because we don't have the vertical connective tissue. We have oblique connective tissue. So it's not pulling one way. So this one, because it's a vertical, it's pulling it. So that's the dimpling of that skin.
Downtime is what?
Downtime is pretty minimal. You're gonna get some bruising.
But they can wrap their legs, go to work.
Correct, yeah. So a little soreness, pain for a couple of days. So you know this one, then you have to wear garment for a couple of weeks. Okay. But you can go back to work pretty soon.